Hi guys, first of all, let me apologize for the headphones. I'm wearing them because the audio quality is better because of the microphone. Hi, my name is Jeff. I'll be your nurse today. We're here to talk about iron preparations, specifically ferrous sulfate, as it's known by its generic name or its brand name Fiasol. So why do we take Fiasol? We take Fiasol to help with iron deficient anemia, also known as microcytic anemia. To understand why we take it for microcytic anemia, we first need to understand the effects of microcytic anemia on us. So blood transports oxygen throughout the rest of our body. It's able to do this because it contains hemoglobin. Hemoglobin is composed of 4 hemes and 1 globin. Each heme contains iron. It is this iron which makes it possible to transport oxygen to our bodies. If we have microcytic anemia, we don't have enough iron to transport adequate amounts of oxygen throughout our body. So if we take ferrous sulfate, we bring those iron levels up to a level where we have enough iron to transport oxygen to the rest of our body. And some of the therapeutic results we can expect from this are that those signs and symptoms we were experiencing can all diminish and even disappear entirely. So ferrous sulfate is prescribed. It is typically prescribed in 3 forms. The most typical is the tablet form. If you take this one, you want to take it the doses spread out evenly throughout the waking hours of your day, because this maximizes RBC production. You also want to take it on an empty stomach because this is how the medication absorbs best. If you receive the extended release tablet form, you want to make sure that you do not chew or crush that tablet because this negates the effect of the extended release and it can also stain your teeth. Ferrous sulfate also comes in the liquid form. If you receive this one, you want to first dilute it in an appropriate solution like water, drink it through a straw, and then rinse your mouth because this form can also stain your teeth. Some of the other adverse effects that you can experience from all 3 types of ferrous sulfate are nausea, epigastric pain, constipation, and diarrhea. If you experience any of these, you can raise your exercise levels, increase your dietary intake, and your fluid intake. If you continue to experience effects, you can also take the medication with food. While this is not the preferred method because it does reduce the absorption of the medication, it can also reduce the adverse effects. If you try this and you still continue to experience these effects, you can notify your provider. So another adverse effect that you can experience from ferrous sulfate, which can be fatal, is iron toxicity. To avoid this, you want to notify your provider of any other iron preparations you might be taking. Iron toxicity is most common in children, so you want to make sure that you keep your iron preparations in childproof containers and out of their reach. Early manifestations of iron toxicity are stomach pain, vomit which can have blood in it, and shock. If you suspect iron toxicity, seek medical help immediately. So, any questions? If there are, I'm here to answer them. You can also refer to the form I have attached below. Thank you and have a nice day.